Dear students, Assalamu alaikum. In the last lecture, we learned about the functions of testosterone and the control of male sexual hormones. In this lecture, we shall study about the male sexual function and its abnormalities and the pineal gland. There are three stages of male sexual act: erection, emission, and ejaculation. Erection. Erection is a parasympathetic function. The next two stages, emission and ejaculation, are functions of sympathetic nerves. Erection is caused by parasympathetic impulses passing from the sacral portion of the spinal cord through the pelvic nerves to the penis. These parasympathetic nerve fibers release nitric oxide in addition to acetylcholine. Nitric oxide activates the enzyme guanylyl cyclase, causing increased formation of cyclic guanosine monophosphate. This cyclic GMP especially relaxes the arteries of the penis and the trabecular meshwork of smooth muscle fibers in the erectile tissue. As the vascular smooth muscles relax, blood flows into the penis increases while the venous outflow is blocked. Therefore, high pressure within the sinusoids causes ballooning of the erectile tissue. Emission. Intense sexual stimulus causes the reflex centers of the spinal cord to emit sympathetic impulses that reach the genital organs through the hypogastric and pelvic sympathetic nerve plexuses to initiate emission. Emission is the second stage of male sexual act. Emission begins with contraction of the vas deferens and the ampulla to cause expulsion of sperm into the internal urethra. Contractions of the seminal vesicles expel prostatic and seminal fluid also into the urethra, forcing the sperm forward. All these fluids mix in the internal urethra with mucus already secreted by the bulbourethral glands to form the semen. The process up to this point is called the emission. The final stage of male sexual act is ejaculation. The filling of the internal urethra with semen elicits sensory signals that are transmitted through the pudendal nerves to the sacral regions of the cord. These sensory signals cause contraction of the ischiocavernosus and bulbocavernosus muscles that compress the bases of the penile erectile tissue. All these effects together cause rhythmical, wave-like increases in pressure in both erectile tissue of the penis, the genital ducts, and the urethra. This ejaculates the semen from the urethra to the exterior. Abnormalities of male reproductive system. In this section, we shall study the abnormalities of prostate gland function, disorders of puberty, and erectile dysfunction. A most common prostate gland abnormality is the benign prostatic fibroadenoma. This can cause urinary obstruction, and there is hypertrophy which is caused by abnormal overgrowth of prostatic tissue itself, but it is not a malignant process. Cancer of the prostate gland accounts for about 2 to 3% of male deaths. The disorders of puberty can either be hypogonadism or hypergonadism. When a boy loses his testes before puberty, a state of eunuchism can result. The boy continues to have infantile sex organs and sexual characteristics. That is, the height is greater than that of a normal man, but the bones are quite thin and the muscles are weaker than those of a normal man. The voice is still childlike. There is no loss of hair on the head, and there is no masculine hair distribution. If a man is castrated after puberty, some of his male secondary sexual characteristics revert to those of a child, and others remain of adult masculine character. So, castration after puberty, the sexual organs regress slightly in size, but not to a childlike state, and also the voice regresses slightly. There is loss of masculine hair production, and along with loss of masculine bones and musculature. Sometimes hypogonadism can be caused by a genetic inability of the hypothalamus to secrete normal amounts of gonadotropin releasing hormone. This is also called adiposogenital syndrome or Froehlich's syndrome or hypothalamic eunuchism. Adiposogenital syndrome is often associated with abnormality of the feeding center, causing the person to greatly overeat. So in this condition, obesity also occurs along with eunuchism. Now, coming to hypergonadism, the hypergonadism may occur because of either tumors of germinal epithelium or interstitial Leydig cell tumors. Let's first discuss the tumors of the germinal epithelium. As germinal cells are capable of differentiating into any type of cell, these tumors can contain multiple tissues like placental tissue or hair or teeth or even bone. They can all be found together in the same tumorous mass called a teratoma. This picture shows a teratoma mass, and you can very clearly see a bunch of hair and teeth in a tumorous mass. If placental tissue is significant in a teratoma, it may secrete large quantities of human chorionic gonadotropin with functions similar to those of luteinizing hormone. Also, estrogenic hormones are sometimes secreted by these tumors and cause the condition called gynecomastia, which is overgrowth of the breasts in males. The other type of tumors that can cause hypergonadism is the interstitial Leydig cell tumors. Although they develop rarely, but they can produce as much as 100 times the normal quantities of testosterone. These tumors in young children can cause rapid growth, but eventual adult height is actually less because of the fusion of the epiphyses. They can also cause excessive development of the male sexual organs and characteristics. Erectile dysfunction. Erectile dysfunction, also called impotence, is characterized by an inability of the man to develop or maintain an erection. The causes of erectile dysfunction include the neurological problems like trauma to the parasympathetic nerves during prostate surgery, deficient levels of testosterone, use of drugs like nicotine, alcohol, antidepressants, and vascular diseases including hypertension, diabetes, atherosclerosis. The vascular diseases reduce the ability of the body's blood vessels, including those in the penis, to dilate. The treatment of erectile dysfunction includes the use of phosphodiesterase 5 inhibitors like sildenafil, known as Viagra, or vardenafil or tadalafil. By the use of these drugs, the cyclic GMP levels are increased in the erectile tissue. And this cyclic AMP then relaxes the arteries of the penis, leading to an increased blood flow to achieve erection. Now let's study the pineal gland. Since its discovery, various functions have been attributed to pineal gland. These include its role as being helpful in infections, in promoting sleep, enhancing mood, increasing longevity, and also in the older texts it has been considered a vestigial remnant of what was a third eye in the middle of the forehead that regressed back into the cranium. Its function is controlled by the amount of light or time pattern of light seen by the eyes each day. The pathway includes the passage of light signals to the suprachiasmal nucleus of the hypothalamus, to the pineal gland, activating its secretions. The pineal gland secretes melatonin, and melatonin decreases gonadotropic hormone secretion in some species of animals. Now, a question arises here: does the pineal gland have a similar function for control of reproduction in humans? Well, this question is answered to some extent by the study of pineal tumors. It is observed that pineal tumors secreting excessive quantities of melatonin are associated with hypogonadism, while tumors causing destruction of pineal gland are associated with hypergonadal function. So perhaps the pineal gland does play some role in controlling sexual drive and reproduction in humans. This concludes our today's topics of discussion.